energy.
Throughout the day, I can focus better. I can concentrate in my work.
Our church worship service lasts 45 minutes. For the last 2 years, I've not been able to stand that long. 2.5 weeks into wearing the X39 patch, the pastor said, "You can now be seated." It dawned on me at that moment that, my goodness, I've been standing this whole time, didn't realize it.
After starting using the technology for approximately 2 weeks, my pain completely disappeared.
32 years of pain gone in 3 days.
I just love the products. They just help me to feel younger and younger year after year.
Thank God for X39.
My skin become younger, softer, firmer.
It's been really, really, really amazing.
I love X39 because it really helped reduce the inflammation in my knee. I can now run again. Woohoo!
I can't hear you, Sunshower. And Cathy, thanks for joining us, and you can leave your camera off until Sunshower introduces you after we do the PowerPoint. And I'm not hearing Cathy either. Maybe it's my system.
No, I'm here. I'm just going to mute myself.
There you are. I heard Cathy. And try it again, Sunshower. Well,
Sunshower, try raising the volume on your computer.
Well, that won't matter.
Well, no, it might be off, honey. Yeah.
Okay. Well, you know what? While you're playing around with that, I'm going to go ahead and do the PowerPoint. How about that? So let me.
Why don't you come back in, Sunshower?
And Robin, your co-host, so you can let her back in. Sorry, ladies and gentlemen. Technology is predictably unpredictable. So we're going to be here with you this evening, and we're happy to share information about this breakthrough in affordable stem cell technology. And test your volume again, Sunshower.
Hello, hello.
There you are. Yay!
Hi, everybody.
Okay, well, I'm going to go ahead and get my presentation ready. You could welcome people for a minute.
Okay.
Okay.
So welcome, everybody. Are you going to speak, or do you want me to?
They're not going to. Maybe you could just kind of give people a heads up what to expect tonight.
Okay, I can do that.
Great.
So a special warm welcome to all of you. Thank you so much for taking the time. This is going to be really special and interesting for you tonight. So you might want to have paper and pen, pencil, your computer, however you want to take notes. This might be a very memorable call. So I am your host, Sunshower Rose, and tonight we'll be having a short presentation from our own Gregory Mascari. And he's going to give a little short presentation about the company and the founder, David Schmidt, and of course, the star of the show, X39. And then following Gregory, one of our practitioners, as you can already see the name, Dr. Cathy Young, is going to be with us this evening and give us a little bit more about, the science and how she may use the patches in her own doings with her own private patients. That's the right word. So, and after that, then we'll be hearing actual results from some of our listeners tonight. So if you have a testimonial, please raise your hand, and that's done at the bottom of the screen on the word reactions, or you might even have, isn't raise hand a new thing that you put on? Yeah, there it is. I see it at the bottom of the screen. So click that if you have a testimonial, and we need you to be brief and compliant and say how your condition was before and how long you used the patch, and then what was the result. And of course, we will need to promote you to panelists. So that's why we want you to raise your hand, and then I'll call on you in the order that I see you.
Great.
Okay.
Okay, well, I'm ready to go. So I'm going to go ahead and share my screen.
Okay.
And very excited to talk to you about LifeWave X39 and the whole concept of stem cell activation. And I first want to share with you a personal realization I came to a number of years ago. I finally figured out what I want to be when I get older, and that's younger. Getting old ain't so cool. I think my grandchildren still think getting older is a cool thing, but us adults, not so much. So welcome to the stem cell revolution, because we believe everyone wants to look, feel, perform, and live younger. And we found that stem cells are the key because they're a vital part of our immune system that repairs and regenerates all the damaged cells in all of our body, organs, glands, bones, muscles, skin. It's, they're very important part of life. But here's the problem. The older we get, the fewer we have. And by age 60, only a small percentage remain. And sadly, the fewer stem cells we have, the faster we age and the slower we heal. Now, what about stem cell injections? Because they've become quite popular, but you know what? They're quite expensive. They can be painful, risky, controversial, and you know what? No guaranteed results. You could spend thousands or tens of thousands of dollars and maybe not get the results you're after. Well, tonight we're here to share with you some really good news, because now you can look, feel, perform, and live younger with a historic breakthrough in stem cell technology. It's a new wearable technology in patch form. It's affordable, safe, non-invasive, non-drug. It's a patented form of phototherapy that uses specific frequencies of light to activate and improve stem cell activity. And this is the brainchild of our founder and CEO visionary, David Schmidt, who's not only a brilliant scientist and researcher, he's a genius inventor with over 130 patents and patent pendings. And David's been on the leading edge of phototherapy research and science for over 20 years, and he's already conducted over 80 clinical studies proving the efficacy of our LifeWave phototherapy products. And you know what? Many more tests are always in the works. Many more clinical studies are all in the works, because LifeWave is a very science-based company. In fact, we're a 20-year-old advanced technology company in the field of health sciences. It was founded back in 2004 based on an energy-enhancing technology David developed for Navy SEALs to increase their strength, stamina, and performance without drugs or stimulants or caffeine. And it was so effective, it's now used by world-class athletes around the world in almost every sport. We have corporate headquarters, laboratory, and manufacturing in California, Utah, and Ireland. And you know what? We already have global distribution to over 75 countries with 15 global distribution centers. So the word is getting out, and our products are so effective, they're now used by pro and amateur athletes around the world in almost every sport. The media's begin to notice, and you know what? You might too. If you look carefully at your favorite athletes and Olympians, you might see the auspicious little white patches like you see in number 94 there, and that's LifeWave phototherapy technology. So how does this amazing technology work? Let me explain it to you briefly. It's based on a type of light therapy called photobiomodulation. And LifeWave patches contain very specific combinations of organic materials and crystals. And when they're applied or near our body, they're activated by our body heat. And then they begin to emit very specific wavelengths of light, which stimulate targeted and beneficial biochemical responses within our body. This is known as photobiomodulation, and it is the foundation of LifeWave phototherapy products. So it's been a well-recognized and proven scientific principle that specific frequencies of light can cause specific changes within the body. For example, we all know when we go out in the sun, a frequency of light causes our body to make vitamin D. We don't get a vitamin D download from the sun. We get a light frequency download, and that tells our body make vitamin D. Now, there's another frequency of sunlight, UV, that causes our body to make melanin, the chemical that gives us a suntan. Well, LifeWave's patented technology is based on this same rock-solid, widely accepted scientific principle. Now, our focus for the last 16 years has been in the area of anti-aging and regenerative science. And we released to the global market back in 2019 the LifeWave X39 stem cell activation patch, and nothing has been the same since. This truly is a historic and affordable breakthrough in stem cell technology. Some are calling it the holy grail of anti-aging restorative science, because we are actually doing what the multi-billion-dollar companies and big pharma have not been able to do. And that is, we figured out a way to activate a specific copper peptide in our body that actually activates stem cells, while also altering gene expression towards a younger and more vibrant you. So it's a game changer. X39 activates our stem cells. It's a true breakthrough. And our founder and inventor and CEO, David Schmidt, says this is my greatest accomplishment yet, with an emphasis on yet, because he's always in the laboratory working on new breakthroughs. So yes, we have patents. Yes, we have clinical studies. Yes, we have field results proving that X39 is actually turning back our biological clock, helping people to look, feel, perform, and live younger. And for us baby boomers, this is very exciting news. So that ends my little part of the presentation. So I'm going to turn the rest of this over to you, Sunshower, and our special guest practitioner.
Well, thank you so much, Gregory. Good job. We always love listening to you. And we have tonight we have with us Dr. Cathy Wong. And would you like to put on your camera right now? And I'd like to introduce you and tell folks a bit about you. There you are. Hi, doctor.
Hello.
Hi. So as I understand, you live in Indiana. How's the weather?
You know, it's actually been surprisingly warm over the last few days. In fact, it got up to about 60 one day. So about 40 to 60, maybe it gets down into the, I don't know, the low 30s to 40s at night. You know, so sometimes it's hard to decide what to wear.
I know, I have to layer up, right? So as I understand, you have a dental license, you have a private practice that you've had for over 30 years. And I must say, we are just so honored to have you. I believe you're the very first dentist that we've ever had as a health practitioner in our Live Younger space here that we do every Tuesday night. So we want to thank you for coming. So you have your private practice that you share with your husband, John, Dr. John, right?
Yes.
Yep. And that you spend one day a week caring for the underserved. What does that mean?
You know, we care for people who don't have good access to dental care. So it's an underserved community. And I was invited probably maybe about 2 or 3 years ago to help out at a clinic that's not far from where we live. And it's the underserved community that we service. It's a different community than private practice.
Wow, well, that sounds quite beautiful. Thank you for doing that. So let's see, how in the world did you come to know about LifeWave? Was it through somebody that we might all have heard of?
Yes, absolutely. So my husband was listening to Michael Jaco, and he said, Cathy, you need to look into this. He was listening to an interview that David Schmidt and Michael Jaco had done, and he sent me the link. And of course, like anything else, I'll do that. And it took me about a month. But when I did dive into the information, it was just, it just rolled from there. And we are so grateful that Michael took the time to share.
And because you're with LifeWave, as I understand it, now you have even more flexibility to do the things that you really love to do.
Absolutely. So, you know, in private practice, you know, what I love about it is that I've had flexibility for quite a long time. And when we were introduced to network marketing a long time ago, that created that avenue for flexibility. But I just love this product. And, you know, we're able to go ahead and share with so many people, whether it be in my office or outside the office, and we just have fun doing it.
Well, I was sure to brush my teeth. I hope you can tell. I hope I don't have bad breath. You can't tell, can you?
No, no, we won't. We won't.
Here on the Zooms, we're kind of lucky for that, I guess. And so I'd like to ask you a few questions. What excited you about LifeWave to just use it for yourself? And then you started sharing, is that right?
Yeah, so I had been introduced to network marketing a long time ago. And what happened was my husband and I always loved to supplement. We've always looked for ways to be healthy. So when he introduced me to this, concept of patch technology, I said, well, why not? I mean, we've already been taking all the supplements, whether it be a pill, whether it be a powder, whether it be, an oil. Okay. So I thought, well, why not a patch? So we originally looked at it for just ourselves and my mother. Well, then, what happens is I tell my sister about it. And she said, when you get it, I'm coming over. I want some. And then it just goes from there. You start to share. And when you have a great experience and you see the science and you see the technology, it just is so exciting at how it has worked and helped so many people.
It does seem to work, and sometimes very quickly. Sometimes we need to be more consistent. For myself, after the second year, I suddenly could smell. I had never smelled my whole entire life. So let's go on with another question. So would you mind sharing a few of your patient stories with us?
My patient stories are the stories that are not necessarily dental. So what I've done, someone asked me, do you go ahead and utilize the technologies for your patient base? And early on, I did and I didn't. But what I started doing as I learned more about the technology, you obviously, are able to share and able to have more knowledge. So you know what to tell them, will know what to advise them. So what I like to do is I like to listen to what my patients have to say, because sometimes they're just coming to me for dental needs and they really don't want anything else. So you really have to listen carefully. But over the past year, as I've learned through this technology, there are so many things that can happen and so many different things that people can benefit from. So as I listen to what's happening in their life, whether it be a medical issue or whether it might be, just something that they want to achieve, better health, then you start to share. And it may not necessarily be sharing from a dental standpoint, but it's sharing just to be healthy. If someone needs better sleep, they need more energy, or maybe they hurt. Okay. So that's a lot of times the way that I'll just introduce the patch technology to my patient base.
And so I understand, right. And so how do you share with your new customers? Or I'm sure you have some brand partners as well, right?
Absolutely.
And how are you sharing with them so that they understand what they can do with these products?
Well, that's a good question. What I usually do is I find out if they're open to new technology, and I just share about, an invention that has just gotten us great results. And I usually share a story. Okay, I tell them something that's happened to my family or something that's happened to a close friend. Okay, and when they have that, when they hear that information, then they may be interested. And then I share the videos and I share all the general information, and I invite them into the community, because that's how we learn. We want to leverage the time and efforts of other people who have, more knowledge than I might have about this.
And this is such a great tribe. We call ourselves a tribe. And one of the things that I've noticed is it helps really to stay well hydrated. Am I right?
It does. So one thing that I always like to tell people is that you always need to be consistent, whether it be consistent at exercise, consistent at brushing your teeth, consistent at flossing your teeth. You need to be consistent with utilizing the patches. You can't use it one day and then take a week off and use it again and expect a result. And then again, stay hydrated. Absolutely. Drink plenty of water.
And so what are the indications? Are we to wear the patches consistently and never take them off, or how does that work?
No, you want to wear them 12 hours on, 12 hours off. You want to be able to give the body a rest. So if you wear the patches 24/7, there's going to be a situation that usually comes up called attenuation. And it's where the signal, the brain starts to ignore the signal that the patch gives to you. So you need to give the body a break. Okay, so it's a 12-hour wear, a 12-hour break. Again, next morning, put it on again. Or if you're a nighttime wearer, it's nighttime that you might wear it. So for me, I have an 8 o'clock to 8 o'clock. So 8 in the morning to 8 at night. It's just something that I can remember.
Something that I help people so that they can remember is put your patches right by your toothbrush and your toothpaste. So
absolutely.
So I mean, you're going to brush your teeth every day. You may as well put on your patch right about the same time, whether it's behind here or under your navel, wherever you're going to put it for the day, right? Are there any contraindications using this technology, Dr. Wong?
Well, the contraindications might be someone who's going through maybe chemotherapy, or someone that's had a organ transplant, because sometimes the drugs that they're taking or whatever they're utilizing is really going to be more like counterintuitive to the patch technology. Now, once someone is off the technology, then maybe they may need to, consult with their physician to see if something like this might work. So really, if you have any questions, I always want to go back. Hey, go back to your practitioner, go back to your medical doctor and discuss that with them.
Mm-hmm. And how long does it take before someone notices something going on or changing in their body?
It depends. Everybody is different. Okay, some people, we call them a one-patch wonder. They put the patch on and they notice an immediate result, whether it could be a warming sensation or just a sensation of well-being. Other people, it takes time. And the body has a list of priorities, and we don't generally get to pick what the fix is. So if you want a shoulder issue to be fixed, but maybe you've got a problem with your heart or your liver or something else, okay, the body is going to go to that area to take care of it. But we also need to keep in mind that subtle changes can happen. And if we're focused just on one area of the body that we want fixed, we might miss something else.
It's true. And it's so interesting that a little patch like what we put on ourselves that is non-transdermal, nothing's going into us, can actually have these kinds of results. And they're so intuitive. The energy of the patches goes where it's needed most first.
Absolutely.
Yes. So is there anything else you'd like to share with our listeners and watchers tonight?
I know that a lot of people probably have dental questions. Okay. So I'll address that just a little bit. So when we think about dental issues, we're talking about immunity. So when we look at the mouth can be a mirror to the rest of the body. So when people are not healthy, elsewhere, sometimes we see it in the mouth, whether it be increased decay or whether it may be gum health or gum disease. Okay. So I always like to think about immunity. So when you boost your immunity, whatever way it might be, it could be taking supplements. And in this case, utilizing the patch technology, you're going to get a boost to your immunity. Okay. So when people feel better, what happens is they have more energy. When people have more energy, they're going to be doing things that they typically might not do. So I always hear, oh, I'm tired at night. I forget, I get so tired, I don't want to brush. But if you have energy and you feel good, well, then you're going to naturally do that. Okay. So caring for teeth, caring for the whole body, is something that we always must do. So going back to dentistry again, we still need to go ahead and seek professional care, because it's kind of like this. If you never washed your hair or you never combed your hair, where would you be? So the same thing, you want to go ahead and brush and floss the ones you want to keep. Okay. And then seek, professional care. Get your hygiene visits done periodically.
Oh, indeed. And when I go for those, I always have either an X39 or my ice wave right on my cheeks, because, well, you can't put them inside your mouth very well, can you? Right. Well, let's see. How about a few questions from the folks that are watching and listening tonight? Would that be okay with you?
Absolutely.
Okay. Thank you. All righty. So I cannot see the hands. I'm going to let Gregory go ahead and if there's somebody whose hand is up.
Yeah, and if you just click on the chat, you'll be able to see the hands. And Lavelle had his hand up first. So go ahead, Lavelle.
Cool.
Hey,
there he is.
Hey, Sunshine, and hey, Dr. Wong. Thanks for all that great information. I've been taking your notes.
Good.
And I like what you said about it builds your immunity. And sometimes you can find out people being sick by going in their mouth because their immune system is down. That's great. I really didn't have a question. I did have a testimony. Is it okay to share a testimony?
We give you 30 seconds.
Yes,
right,
absolutely.
Here we go. So
sure.
a friend of ours, she's new grand partner with us. She was born with a curvature in her back, and they did a surgery. And her entire life, and now she's around 40, but in her entire life, she's always had tension because of that surgery. She put the X39 on, and in a half an hour, that tension went away. Just wanted to share that story with everybody. Amazing.
It never ceases to amaze me when people have a story like that. I love to hear those stories.
And now she just enrolled, I think she's going to be a hit manager. She just enrolled like 3 people really quickly. She said, oh my gosh, this is the best thing since sliced bread. Back to you, Sunshine and Dr.
There you
Wong.
go, Lavelle. Thanks so much. I'm sorry, I don't see the hands up. Oh, here we go. Cameron, is it?
Yes.
Okay. Hi, Cameron.
Hello, good evening. Okay, so yes, I have a question. I just want to clarify about the patch wearing 12 on, 12 off. I do the same thing. I put patches on at 8 a.m. I get up at 5 a.m. I go to bed at 10 p.m. So I put patches on at 8, and then I put a different set of patches on at 8 p.m. and I take the original ones off at 10 p.m. So I'm wearing them for 14 hours, but I'm wearing patches 24/7. Now, just to clarify, that is okay, right? As long as it's not the same signal and the same patch 24/7.
You're absolutely right. So it's not the same patch. So each individual patch you can wear for 12 hours at a time. So you can use multiple patches and then it's a 12-hour wear.
Good. Perfect.
You got it, Cameron. Thanks for asking. Good clarification.
All right.
Okay. Looking for another hand. I don't see hands.
Yeah, Kristen, I think is next.
Thank you, Kristen. Go ahead, please. Unmute. Just unmute, girl. You can do it. I'll give you the count of 3. And then we're going to move on. 3, 2, 1.
Here I am.
Okay, you made it, girl.
Sorry. This is a totally different way of using Zoom than I'm used to. I have a quick testimony that precedes a question. When I started using the patches, I was using X39 and Eon, and about 5 months into the patches, I went to the dentist and had a cleaning. And the hygienist said, there's nothing I can do to your teeth to make them any better. She wouldn't touch my teeth. She said they were perfect. And I'm going, well, that's interesting because I was a month or so late for my cleaning. Now, I've never had really bad cleanings, but I've never had one that said, you were perfect. So my question is, what is the X39 doing to your mouth that you're not producing any tartar on your teeth?
That's a good question. So it all goes back to immunity.
Really?
So when you utilize technology that creates a younger, healthier you, okay, so think about it. When you were younger, most people don't have all the dental issues they have as we get older, as we age. So if you think of someone who is maybe a teenager or a child, when they come on in and they get their teeth cleaned, there's generally very little buildup that we see, okay? So when you use the technology and it creates that younger, healthier you should see it reflected in that way. And everybody's different.
So would it prevent cavities also, possibly?
That's really a good question. And to tell you the truth, that's not something that I've really delved into. So decay is a different animal. And a lot of times it comes about from diet. It comes about by the shape and the position of a tooth. Okay, but certainly if you've got, if you've got better immunity, you have a better way to combat a lot of different issues that may cause tooth decay.
Okay, thank you.
Thanks, Kristen. Great questions. And what a great testimony you gave us.
Yeah, I love that.
All righty. Would Adam be next, please?
Yeah.
Okay.
Yeah. Hey, everybody. Thanks. Is it Sunshower? Yeah.
Sunshower.
Great name.
Thanks.
Hi, Dr. Wong. I am very new with LifeWave, and I actually just received my my first patches today. And I have a dental question. About 3 weeks ago, I went in to fix what I thought was a like just a filling that had partially come off a while ago, and it started to get sensitive. I was getting little jolts. And my dentist put the tool in there to check it, and I nearly hit the ceiling in pain. So he said, yeah, the nerve is dying in your molar, and so we're going to have to take the tooth out or do a root canal at some point. Yeah, ever since he put the tool in there and kind of tweaked the nerve, now it just is hurting a lot more often, a lot more severe. So my question is around like sort of patch protocol, and have you seen somebody with a sensitive or maybe a dying nerve kind of come back to health and calm down? And if so, what sort of patch protocol would you recommend, like where to put it and that kind of thing?
Well, I would be using, X39. You might consider glutathione. Okay, that's for detox and repair. And you might also consider Eon for inflammation. And where you might place it is, it's the area where it bothers you. So if it's on the lower jaw here, you might place the patch there.
Yeah, I'm feeling it right through my jaw, up and down here. It's an upper molar here. So what like right there, basically, eh?
So wherever it hurts. So if it hurts right here, that's where I would consider placing the patch.
Right. And Ice Wave, Eon, I just put Ice Wave and Eon on a couple hours ago for the first time. So
how is that working for you? Is that helping?
I feel okay right now. Yeah. Comes and goes. So it's too early to tell, but I have high hopes.
Okay.
I have high expectations.
So Adam, since you're new, you may or may not know that our very own Robin will suggest that you can put more than one patch on in one place. So if you have something going on in your jaw over here, you might try X39. And if it's not doing the trick, add the Eon and maybe the glutathione. It's okay. We call that pancaking.
Okay.
And so I'll just jump in, Adam, and give a little bit of in oral dental testimonial, Dr. Wong, when I had, some work done for an implant, I had an extraction, and then they have to go in and drill and all the stuff they do to get you ready for an implant. I put the Eon and the X39 right there. And I was very concerned when the pain reliever, whatever it is, the Novocaine was what was going to happen when it wore off. And when it wore off, it wasn't bad at all. And I had very little swelling. So I'd suggest, Adam, just as Sunshower and Dr. Wong were saying, I just put it right there. And with the Ice Wave, you may put one here and one over here because it kind of they work as in tandem with each other. But you'll be surprised, and I wouldn't be surprised if your tooth regenerates.
Yeah, the tooth is not in bad shape, the dentist said. So I'm just really praying to have a rejuvenation of the nerve, and if things calm down, I can keep the tooth. So
yeah, good luck.
Thank you, everybody. Cameron's my sponsor, by the way. He's amazing.
Oh, that's awesome.
So I just wanted to say that. Thank you.
Go, Cameron.
Thank you very much. And we're going to get you some glutathione soon. Since Adam's in Canada, it's a little bit tricky at this point, but we can do it.
Okay.
Okay.
I see another hand. Joanne, please.
Hi. The first day I got my patches from my sponsor, I'm a chiropractor. So where I work 2 days a week, the table is too low for me. So I bend too much. So my back was aching. And on the second day of the ache, she told me where to put the patches. I put it on. Then by the end of the day, I realized my back didn't hurt at all. And I did nothing for self-care, nothing chiropractically that would have changed it. And then the other thing I noticed, my right sacroiliac joint always hurts. And I noticed maybe it went from a pain level of a 6, where 10 is the worst and 0 is no pain, to about a 1. And that was it was not even 4 hours with the patches. So that's been gone since then. Then the other thing, I've had some dental work done, and there was always a subtle swelling on my right cheek. And then I put a patch, my person, Charmin Johnson, she told me to put a patch right under here, under my jaw. And when I woke up, I didn't see any of the swelling. And actually there was no wrinkles here too. That was an extra bonus. But right away, the first day, I saw so many changes. It's just remarkable. So that's my story. Thank you.
Thank you so much, Joanne. Does anyone else have a question for Dr. Wong?
Or a testimony? I think Michelle's got her hand up.
Okay. Hi, Michelle.
Hi, I'm trying to, there's my video.
There's you.
Hi, sun shower. Thank you for hosting, dear. It's wonderful. And hi, Dr. Wong, welcome. So I have a story and a question. So I had an implant about a year ago. And like Janet Kiefer said in the chat, I used Ice Wave and X39 and there was no pain. Like literally he prescribed some heavy duty opiate and I never even filled the prescription. Now I'm going in for another one. I'm actually having an extraction of a root canal tooth. And the dentist is a biological dentist, and she's going to do the extraction, a bone graft, and the implant all in one day. And my fear level, Dr. Wong, is pretty high. I'm pretty nervous about this. So I wanted to ask two questions. One, I know Eon would be very good for stress as well as, the swelling, as Gregory was saying, he did Eon and X39. So what patching protocol, which patches and where for stress and for possible pain, and also for clearing the anesthetic, which I'm very sensitive to. So I would like your advice on where to place the glutathione.
Well, I would be thinking X39, glutathione, Eon, and Ice Wave. Okay, so I would place the X39 where you normally would place it, either behind the neck or below the belly button. Okay. And the glutathione, you might be able to place below the belly button too, and go ahead and utilize your Eon and your Ice Wave for right around the area where you're having your surgery.
Okay.
And we talk about pancaking or stacking our patches. So we could do that too. So you could stack your patches, but I would play with that placement of that Ice Wave. And you might be surprised, at just, how well you might do, because if you've been patching for a while, your recovery, I think, would be, a lot.
Yeah, 4.5 years. Yeah.
Oh, yeah. I think you're going to be
where,
fine.
Where would you suggest the Eon for the stress part? I mean, do you think maybe 2 Eon patches, one on the surgery site and another one somewhere also, or do you think one would be enough to take care of?
I think one might be enough, but I mean, everybody's different. You can play around with it. The other day, I was a little clumsy and I bumped my foot in the corner of a door, and I had my Eon patch on. So I took it off the back and put it right on my toe, and instantaneously that hurt went away. And then, I went to bed that night. So I just put it back on behind my neck. And you know what? I had forgotten that I had hurt my foot because it never bothered me again. So, that placement initially in that one area of injury or trauma, in this case, where you're going to have the extraction and the implant placed, may be short term where you can move it around and put it somewhere else. Because I do know that if you're wearing something on your face, sometimes it can be a little cumbersome depending on what time of the day it is.
Okay. Thank you. Thank you.
Kristen, did you want to come back on? Thanks so much, Michelle. Kristen, did you have something else?
Yes, I can't get the camera to work. Can you hear me?
Yep, you'll be our last person.
Okay, I'll just speak then because camera's not coming on. I have a question. My daughter has a lot of issues with her body, which is really manifesting in her mouth. She just recently had a salivary gland extracted so that they could test for a disease that starts with an S. And they came back and said, oh, yes, she's positive for that. So I'm wondering if, Dr. Cathy, if you have any suggestions relating to that because she doesn't have enough saliva in her mouth or her eyes. Not that you have saliva in your eyes, but she doesn't have any tears in her eyes.
Yeah. So I would probably go back. Is she patching right now? Is she utilizing technology right
she's
now?
not. She thinks that they will help her, but it's a financial issue at this point.
Yeah, she might. If finances are going to guide you, I would utilize X39. You'd be surprised at what it can do.
Yeah.
It can do a lot of things.
Yep, that's what I keep telling her.
Thanks so much, Kristen. And
thank you.
Thank you, everybody. Thank you, Gregory. Thank you, Dr. Wong, for taking your time with us tonight. And thank you for everybody that attended. And, you know, I bet you learned a whole bunch that you weren't expecting on our health practitioners call tonight. And if you are a guest, please get back with the person who invited you to this call. And, you know, if you decide to get started, which I recommend that you do, we've got a wonderful program just for customers, like several. You could go, you have your choice, but you need to talk to your person that would be sponsoring you. And then if you decide to actually share these wonderful patches and not just keep them to yourself and make it a big secret, then just know that this company has a very generous compensation plan, and you'd be very happy that you joined us as a brand partner. So I just want to thank everybody one more time and say good night to all.
Yes, thank you.
You're so welcome. Thank you. See you next week, everybody.
Good night. Good night.
Good night. Thank you.
Good night, everyone.
Thank you, everyone.
Good night.
Bye-bye.